There's certain U.S. patients who have spinal problems and need intervention, surgical intervention, either orthopedic or neurosurgical, and they're excellent candidates for being treated at AIMIS, where there's a focus of spine expertise and particularly minimally invasive spine expertise. One of my specialties in practice is minimally invasive spine surgery, and also I treat a certain lesion. It's a rare lesion, and there's very few people in the world that treat that problem, so I bring that to the table. Tarlov cyst is actually a meningeal cyst, or a cyst in the spine, and the cyst is actually a nerve. It's one of the spinal nerves. It's not a cancer. Essentially what happens is that spinal fluid becomes trapped inside of a nerve root, and as the nerve root expands and balloons, it puts pressure on other nerves around it and causes symptoms. There's also other types of spinal meningeal cysts that are grouped in with the term Tarlov cyst, even though they're slightly different. But they all typically occur within the spine, within the spinal canal, and they cause compression of other nerves. And they can cause symptoms wherever they're located in the spine. The most common location is in the lumbosacral spine, where they cause some very severe symptoms like sacral pain, or pain radiating down the legs, pain and numbness in the perineum or the privates, bowel and bladder dysfunction. Imagine not being able to sit due to sacral pain. It's a very debilitating disease. And the cyst, there's very few spine surgeons that treat these cysts because the surgery is essentially surgery on a nerve, and many surgeons are reluctant to do so. In fact, most spine surgeons avoid the nerves at all costs during a spine surgery. So that's what makes it a little bit more of a unique lesion to treat, and there's just not that many people to treat it, and I've developed a technique that works very well for treating the cysts, and I've had excellent results with it. The treatment of Tarlov cyst patients has really exploded in the United States as far as I'm concerned. Over the last 3 years, I've treated over 350 patients who have come from all over the country, and what has happened now is that has started to translate into international cases. And as you can imagine, it's difficult for patients in Europe or Asia or the Middle East or Africa to come to the United States to have treatment, and AIMIS provides me an excellent vehicle where I can treat these patients closer to where they live, and it makes it easier for them to seek care and get care. And the hospital and surgical services that are offered at AIMIS are excellent, so I have no problem taking my surgeries to that location and really providing a service for these patients overseas who wouldn't normally have access but are still suffering greatly with no or very few options for other types of treatment where they are. Many times insurance companies have their own motivations and will try and find ways to not cover patients with unusual or rare diseases. So I think doing surgery through AIMIS provides the patients with an opportunity to seek care internationally and maybe get something that they wouldn't normally have access to in the United States. The surgical services for treatment of, for example, the Tarlov cyst that I treat, the treatment is wherever I set up my team. So whether it's here or overseas, it's still the same team providing the same surgery and services, so that doesn't change. It's a constant. Minimally invasive spine surgery has no limits at this time. I mean, basically, just about everything that has been done with open surgery eventually finds a way to be done minimally invasively. So obviously that's a general statement and there are limitations, but 5 years ago there were many types of surgeries that were not considered reasonable for minimally invasive surgery, and now they are. Certain spine tumors, certain traumas, infections, things like that. So right now I really see minimally invasive spine surgery as not having any limits, and the only limits are the creativity of the people who apply it, the surgeons who apply it, and really the technology. As technology continues to improve and unfold and develop, the applications that it can be used for expand.